Hyaluronic acid is a natural component of the joint fluid and cartilage as well, so it's sort of replacing some of that lost proteins and improving the viscosity of the joint fluid. So this is usually what we reach for first. We use it really commonly and get really good results depending on the course and on the joint and the individual factors. It might be something that you only do once, and it might be something that you need to do every 6 to 12 months. Another treatment that we have is something called PRP, so that's platelet-rich plasma. And this is what we call regenerative medicine. So we harvest the blood from that samples, spin it down to concentrate the platelets into a smaller fraction of blood, and then inject it back into the joint. And what that does is provide tissue growth factors that help to the cartilage is not great at repairing itself, but helps in that process. Another thing that we have is 2.5% polyacrylamide gel. This is a relatively newer treatment. It's essentially has a similar structure to hyaluronic acid, but it lasts longer. So it's really nice and cushiony fluid, and it really improves the elasticity of the joints. That's PRP and artery is the brand name of this product. That sort of things that we would reach for if the inflammation was really severe, or if you're using corticosteroids and hyaluronic acid and it didn't work in the first place, or it stopped working after other things that we might use, so IRAP is interleukin receptor and having protein. So interleukin-1 is one of those bad guys in the joint, inflammatory cytokine, and it's one of those ones that sort of has a cascade effect, so it sets up a whole lot of secondary inflammatory processes there. So this protein antagonizes that, so it down-regulates that cytokine. That is made by, again, harvesting the blood from the tissue itself. It's then incubated with these special pregnant glass beads for 24 hours, and then that's not something and then again, stem cells, part of this regenerative yield. So stem cells are actually harvested from the muscle, bone, all of that, sent away for processing, and then returned to the now into sort of the more new to wonderful or sort of extreme end of the cases. So not only it's scary, we don't do these sort of processes commonly. But facilitated ankylosis is essentially fusing the joint together so that there's no pain from friction of worn down cartilage between the two sides of the joint. There are sort of a couple of ways of doing this. So there's a chemical, so we can injecting somewhat irritant substance into the joint. The sort of actual application of this, we tend to use it in hot joints, so in very low motion joints. It's done under, so we have to confirm that hot joint doesn't communicate with the joint higher up. So that is done under X-ray guidance. We actually get contrast holds first, just to make sure where that joint is and what it's communicating with, and then check that the substance is there. And then, a couple of months down the track, you find that because the joint has fused and there's no sort of micro there's no stability that forces it really up. And it doesn't interfere with range of motion. Other ways of doing that same similar things by using laser heat or by drilling through the joint to remove the cartilage. That's something done with a general anaesthetic for your extreme cases. 4 hours. And then we've got surgical anesthesia. So this is similar to ankylosis, but it's using a surgical implant to stabilise that joint. So our most common application is used for Aston arthritis or rib bone, where we essentially, again, obviously under a general anaesthetic, we remove all the cartilage from the joint and then fix it in place. So that they really severe rib bones.
The sound must be like a horse after an operation like that.
Can be really good. So it does take a long time. We would say expect sort of a 9 to 12 month recovery period, but yeah, really good results. A lot of the time, I mean, it depends on the joint and the time frame, and also what you're expecting from, with a pastille basis for low levels of pleasure riding. You're not going to get that force out jump. So just basic things, kind of in the day-to-day management of osteoarthritis, keep them active, keep working them, don't skip your warm-up, that's the most important part. Get them out in the paddock moving around as much as you can. Keep their feet trimmed properly, manage their weight, consider a joint supplement, and could have this at the top, consult your vet. Because I guess it's really important to know what you're dealing with. It's hard to know if arthritis is a problem as you come in, and if you do, then you tailor a plan, including all of these different things, as well as your prescription medications. Very severe things, you're concerned with your procedural fixes as well. Does anyone have any questions? Again, we don't have great evidence for it. So in dogs, it's quite good. They, in terms of, again, those inflammatory markers in the joints, see reduction in those, because we don't have good anecdotally, it's hard to say because often we're using it in combination with other treatments. Make horses feel more rested. I guess you do have to sort of consider placebo as well. But it's the kind of thing, say, you started when the horse is 6 or 8, you might not really know what it's done, but you have a horse that's 12 and
Chemical ankylosing spondylitis.
it's no standing. Yeah. So just under sedation, because it's similar to a point injection. Yeah. Any other questions? Would you still ideally? I mean, ideally, use everything. Yeah.
Cheers, thank you, Kate. We'll just load up the next presentation there, but that is a daunting subject for Kate to present because there's literally a minefield of every single question you could be presented with every single one of those drugs and topics. So, once again, with all those medications and drugs, it's sort of always consult a professional in regards to which are the best ones for you individual to go with. But I'm sure if you want to have a chat with any of us after this regarding specific products, we can do that as well. Cecilia will display the movies as well if I just
keep clicking next, it'll play videos. Yeah.
Okay. Rightio, so I'll just crack on with my talk now. I'll be speaking about the advanced imaging techniques that are available for further investigation. Now, these imaging modalities we only really get into once we've done the initial layers investigation. We've possibly already done nerve blocks, maybe x-rays, ultrasounds, and we either still don't know where the lameness is originating from, or we've localised the area, however, we still can't pinpoint exactly what the problem is. So this is, once again, why we use them. If the other ones, the other traditional diagnostic modalities like ultrasound and X-ray, flexion tests, they're not telling us the answer, or we just have no idea where it is. Like sometimes you just like, I've looked at this horse, there's something not right, we know it's a pain-related thing, but we still have no idea. So we can look into this further. So what is the difference between MRI or scintigraphy, or the other one I should probably say is CT, there, computed tomography. There's a couple of advanced imaging techniques available for horses. Now, this is where the difference is. If you don't know where the pain is coming from, or you're not sure what the problem is with the horse, the area to go for is nuclear scintigraphy, because this is where you do a whole body scan of an animal, and you can actually find out where the area of inflammation and therefore pain is. Nuclear scintigraphy, I'll go into a little bit more in regards to what we do with it and how it works. But if you're looking for the problem or when you can't, nuclear scintigraphy is definitely the way to go. If you already know where the problem is, and I think Kristen touched on it before, if we've localised the pain, for example, to the foot or to the knee or the hock, our MRI machine is the only one here in Western Australia that can do horses, and you can scan up to pretty much above the knee and above the hock, so you can do all those locations. If you know where the area is, for example, the most common area we see affected is the foot, then MRI is the best technique to do, because that will actually tell you what the problem is in the foot, where other imaging techniques like X-ray or ultrasound won't. And MRI will penetrate into a hoof capsule. It doesn't matter what material is there, as long as you haven't left a shoe on the foot or metal, you're good to go. So that's the difference between the two types of imaging there. So onto scintigraphy or bone scanning. Gun and I and Kristen or Kate will give tours of the scintigraphy suite after this, so everyone can have a look. I've got a couple of movies here to have a look. However, the very important thing I want to stress is it's got nothing to do with heat. So this is not a heat scanner. Heat scanning in horses is not very good for anything below the skin surface. Sure, they'll pick up, if you've got a warm foot or a warm area, this imaging has nothing to do with heat. So it is extremely good modality if you're trying to deal with upper limb lamenesses. So, for example, we were talking about that hip lameness before, a neck problem, back, shoulders, stifles, anything that you can't get to easily, or somewhere that like an X-ray or an ultrasound just can't penetrate into just because of the horses. They're so big, they weigh 500 or 600, 700 kilos. So nuclear scintigraphy can see into those areas. So for very complex lamenesses or even multiple site lamenesses, say if you've got a lameness up front and behind it, it's just such a confusing lameness that you've nerve blocked all the way up both legs and it's still lame, this is the type of imaging you need to find where the problem is. Now, how this works, like I said, it's got nothing to do with heat. What we do is we actually inject them with a radioisotope, so radiation called technetium-99. We put in a catheter, we give it IV, and generally about a couple of hours after the injection, we then scan them with this giant thing called a gamma camera, which moves around the horse. And this will show up these areas, they're not heat, but we call them hot spots, just because it's a very easy term, rather than say increased area of radioisotope uptake. So, we don't have to mumble that every time. But it's where there's areas of either exposed to hydroxyapatite, increased areas of calcium or phosphorus, these important areas where there's a lot of bone remodeling occurring, or there's an inflammatory response happening. And you get all these radioactive isotope markers accumulating in that area, and it results in this area of increased radiopharmaceutical uptake, aka hotspot. So I'll show you some images soon, but there's always going to be normal hotspots in the horse, for example, around growth plates, young horses, or just general areas that have always got a lot of growth going on. But I'll show you those in here. So it's a very safe process. We inject them. They do have to stay in hospital for 2 days afterwards, just because they do have this dye running through them, this radioactive dye. But it's like I said, it's very safe. We walk them into the suite. The machine moves around them, and all they have to do is stand in the one spot. We only have to give them sedation, so it's very, very safe for the horse. So this is, how do I play this movie, Cecilia? Thanks. So this is just, them walking into the area, and they just have to literally do that and stand there in the middle. This is the big data camera we use here. So this can move up all around. So what is and you can scan them from any angle you want to. So you can scan them from the side, you can scan their necks, go above them, pelvis and everything. So it's a very, very useful tool. So in a minute when we're done here, it's very good to come through and see the actual scanning process. We then capture the images with the gamma camera, and even on this from 10 or 15 meters away, you can actually see the problem in this horse. You can see that it's got a red hot hock on the left-hand side here. It's actually got a hock fracture that was unable to be picked up prior. I'll show you the images we captured of this one in a second, but you can see sometimes that it's very easy to tell where the problem is. Like I said, it takes a bit of work doing all this, but it's very safe for the horse. It does take a fair bit of time getting the images, because then we need to process them, interpret them, and write reports, but it will generally find where the problem is. So this is an example of what we might find in a very severe case. This was a horse that had already been seen by 2 other vets, and I even looked at it as a referral that came here. The horse was crippled, laying on its left leg. I had no idea where this was coming from, and neither did anyone else, even with nerve blocks and all these other x-rays and ultrasounds done. Now, in a really, really painful cases, sometimes nerve blocks just don't work. They just don't work very well. And so what we ended up doing was, right, let's go ahead and bone scan it, or put it in the scintigraphy machine, and we all felt like idiots very quickly, because that's how obvious it makes things sometimes. Down the line, what we ended up doing with this horse, we didn't actually go ahead and MRI it because of how obvious that is. That's going to have to be a stress fracture of some description, and we didn't want to risk a recovery from general anaesthetic with a fracture, but we ended up x-raying several months later, and you can see all the new arthritis formation around where the fracture was and everything. So it's a very good machine if you can't find where the problem is. Like I said, we can also, with this machine, look into cervical neck pain. There are a lot of horses out there that do have neck pain, and it's very hard to tell just with an x-ray whether there is a problem there. They have to have a decent amount of change on x-ray for it to be a problem. And look, even some of these, facet joints we have here, we know, they'll always have a bit of increased pharmaceutical uptake, but it's a bit of an art when reading nuclear scintigraphy images to know what's normal and what's abnormal. Red doesn't always mean bad, but look, in this case, this has a really, really hot, C4, C5, and C6, C7 articular facet joints, and this horse did come in for a neck problem. Also in race horses, usually young horses, Kristen touched on it before, you can't generally see stress fractures on x-ray. So it's a fantastic modality for finding out acute lamenesses, ones that have just recently happened. This is, once again, this is a distal tibial stress fracture in a racing standardbred. We actually, this one came in, we did actually x-ray it, couldn't see anything. We said, box it, bring it back in a week or so, still couldn't see anything. So we ended up doing a scintigraphy, and that's what we found. So once again, it makes things a bit easier. Now, it can also see soft tissue injuries to some degree, but it's much better with bone. This is what we would see with, say, a high suspensory injury in a horse. You can find these also. Ignore the calcaneus up the top here. This is where I said it's a bit of an art. There's always a lot of radiopharmaceutical uptake and turnover in a calcaneal area. However, this is where you have to compare images and just know what's normal or not. This is the exact area for a proximal suspensory attachment. And, you know, based on the nerve blocks, other imaging we've done on this horse, you know, it was very clear cut that we had a proximal suspensory injury in this animal. So it is useful for some type of soft tissue injuries. What it won't show is, you know, muscle tears and things like that. So this isn't those type of problems. However, anything orthopedic related or tricky lamenesses upper limb, this is a fantastic thing to use. And the other thing in regards to, I know someone asked about diagnosing hissing spines and a good way to do it. This is actually quite a good machine because it will tell you if there's active uptake or impingement of the dorsal spinous processes, if there's an active problem going in there. So you can actually see around the thoracic spinal region, we do have some pretty significant hissing spines here too. So you can scan the back and read everything with it. So what is MR? Any questions about scintigraphy? You can jump in if you want to, or no? Okay. MRI, magnetic resonance imaging. So this is using some very fancy magnets, and that's the machine that you can see through into the surgery there, to give us really, really high quality images of a specific area. So MRI is really the gold standard. If you know where the problem is, MRI is the gold standard of telling you what it is. It's very rare you have these days, if you have a knee problem or a wrist problem, they'll go, I just go get x-rays or an ultrasound. No, a lot of the time, with humans, they'll go, you need an MRI because that gives you the best quality images and it will tell you exactly what the problem is. So, like I said, it's extremely good for soft tissue injuries. So like suspensory problems, anything within the foot capsule that you can't see with an ultrasound or you can't actually get an answer with an x-ray. So navicular bone disease or navicular disease. Now, navicular disease, there's heaps and heaps of different problems with that. It might just not be the bone, there might be a deep flexor tendon tear, there might be an impar ligament. There's a whole different range of syndromes when it comes to navicular disease, but MRI is the gold standard to diagnose exactly what's. Show you collateral ligaments, it will show you arthritis, it will show you even pedal bone bruising, it will show you fractures, it will show you infection of the area. So it's a really, really good diagnostic if you know where the area is of pain is, and it pretty much tells you the answer of what the problem is. So this is the MRI here in use. Cecilia, do you mind just playing that video? So they need to be, the reason they need a general anaesthetic is because they need to be still. They, like even them, sometimes breathing will distort the image we get. And this is what we generally do here. They only need a very quick general anaesthetic, but we can just play this movie as well, Cecilia. We generally pop them in with a hind limb here, and we're actually scanning this one Aston. And you can actually see this bone bruising already that you can see here in the condyle coming down. But there's many different ways to do this, but giving them a general anaesthetic is the gold standard because they don't move and you get the best image quality. And like I said, this is the only machine in Western Australia available for this. So this is what, some of the types of imaging you see when you scan, say, a foot area here. You see, the long pastern, the short pastern, you get the pedal bone, you get the deep flexor tendon down, you get the navicular bone, you get all the little tiny impar ligaments and navicular suspensory apparatus, collateral ligaments. It depends on what type of sequence of imaging you're using in the machine. Like sometimes with this bone will be black, sometimes it's white. It just depends on what type of imaging you're selecting and what you're trying to highlight. So in this, fluid is white, so we can see all the fluid areas, and in this tendon is black, so we can see if there's any injuries to the tendons. But it's a very complex way to try. It's very hard for you guys to read these yourselves. I'll show you a couple of very obvious images of problems in a second, but I read them to some degree myself, but we also get another specialist radiologist involved to read a lot of these images to help provide the reports because they get complex quickly. This is another video. This is an example of a MRI of the amount of detail of that video. Play that one then. You go up. Yeah. So this is this is just me scrolling through, and you can see the type of detail you get with this type of imaging. You can see absolutely everything. Do it in 3D slices, every single different angle. So that's just one example. So there's a prize to whoever tells me when they can spot the fracture and what bone it's in here. So if we hit play, we'll go back. So this is one that I had in that book we couldn't see on X-ray. That's the fracture. Can you go? So we'll play it again, but there's a big white line going through the bone here. Does anyone know what bone that is? Someone have a guess? Someone said the answer. Who said pedal bone? There you go. You can one of those. That's all right. So you should speak up a little bit more, guys. Yeah. And yeah, so without the MRI, we'll just play that again, Cecilia. We've been looking at this horse literally for about a month, and we X-rayed this, and it was still lame. Like it initially got treated for an abscess, which any person would, and it just wouldn't get better, and you couldn't even see it on X-ray. So this is just a very obvious example of why MRI, going to some type of diagnostic modality like this is extremely helpful. Could I just tell you the costs if everyone's wondering what these things are? Now, we always do the general lameness assessments first, and if I think it's something you can nerve block in an X-ray, ultrasound, yeah, we absolutely go that way. However, a lot of the time, you may have really spent $1,000 or $1,500 on those things and not have an answer. So MRI, yeah, it's about $2,000 plus a report fee, depending on how complex it is. And scintigraphy can range anywhere from about $2,500 to $3,500. $2,500 would be a body where we just say do half the horse, the hind legs, pelvis, and back. While $3,500 that would be the entire body, back, neck, head, everything you can think of. So that it does range a little bit there in regards to costs. But if you have been through everything else and are still scratching your head, or you've got a very complex lameness, there is a way to get you an answer. So with our machine here, we can scan everything up to knee. So you can do foot, fetlock, knee, distal radius, or distal tibia. I don't think I'm pretty sure, the one we had in Werribee, you could even scan knees or hocks. I don't think there's any machine in Australia that can do higher than those locations. In Europe, I've seen 1 or 2 places that you can do a head or part of the cervical vertebra, but currently, to my knowledge, there's no equine machine that can pretty much do higher than that even in the little. Oh, I can make it higher. Yeah, but generally you can't do it higher than that.
And you think this probably just
Yeah, you can. You can. The question was, can you do a scintigraphy of just a specific area like the neck? Yeah, you can. Generally, the cost of that is about, I think it's about $800 or $900 to do that. The reason it's still quite costly is because the drug that we buy, the technician, is quite expensive, and the dose of technician doesn't change whether you do the neck or half the body of the horse. The other reason we may do a specific location would be if we've had, say, a tourniquet injury and we're afraid of a blood supply problem to a leg. You can see that you can always see the leg, or it's. Go back to where we were. You can always see, a bit of a leg. You can even see the blue outline down here of a leg. If you had a blood supply problem and you had it, the leg was going to fall off and you need to work out if there was blood, you would actually just get a black image from there down. So you can use it to work out blood supply issues as well, which I don't know. Sure. So the question was, what do you do if there's a soft tissue injury that's above the knee or hock that you want to image further that you can't MRI? Ultrasound. It's as specific as we can get. Yeah. So currently, and I suppose the good thing about that is soft like injuries above the knee or hock that need that type of additional imaging. Are not that common. So it would be falling in the less common bracket of anything regarding that, and usually ultrasound will be able to give you your answer there, usually. But a lot of the time, you may end up, if you're not sure what that area is, you might actually bone scan it as well, or do the nuclear scintigraphy to see if you can see anything. Because usually if you've got a lameness up higher than that, if it's muscle, they get better, but it's most likely going to be an orthopedic thing. Any other questions? Rightio, do I have to give away more stuff, Caleb? I sure to give away one more. Let's do a quick question then. I know a lot of people know the answer to this. Seeing we're coming into the breeding season, what is the gestation length of the mare? There's the first one over here, I heard. You were too polite. Well done. So that was 11 months, 11 days is generally the accepted around that period, but then mares go early or late and they're bane of your existence. Okay, so Caitlin Garnett, do you want to come up? That concludes the information night then, unless anyone has any other questions while we're all standing up here. Once again, we're going to go ahead and do some tours of the scintigraphy area, and then if anyone wanted to, even see, the breeding barn or anything else, we can take you on tours out there and show you everything. So there's Garnet, myself, Caitlin, there's Hannah, Ella, Hayley, even Emma, everyone. If you need to see anything, but come see us for any questions and visit all the trade stands and so thanks again.
Hey, thanks for tuning in, everyone, and should be able to view it again on our channel if you want to rewatch. Okay, thanks for joining us.